Going live.
We are live. All right. I'm making sure the link went through. Looks like it did. So we're ready to roll.
Groovy, brother.
All right. Today's cardiac. We're going to do an hour of cardiac. I've got 100 questions. I don't think we'll hit them all. But at the very least, we can try, right?
Okay.
Hopefully somebody gets on. Otherwise, it's all you, sir. You can do it, right?
Sure.
Is that big enough for you?
Yes, that's plenty large enough.
Okie dokie.
My presbyopia is not that bad yet.
You sure? You sure it's not bad yet?
Well, it's pretty bad, but it's not that bad.
Okay, good. All right.
I'm up to 2.5s.
Oh, 2.5? Oh, yeah. See, mine's not that bad.
No.
You got old man eyes.
Yeah.
Although we got some people who have worse. So, all right, we're going to 11:10. Let's do it. Which population is at highest risk for dying from a myocardial infarction?
Population is at a higher risk? Huh. Well, that's a good question. I want to say Caucasian males.
It is not Caucasian males.
Well, I'll be darned.
They have a high rate of the artery disease.
Well, that's exactly why. So that's okay. So I'm going to say African-American females.
Exactly. Caucasians have a higher rate, but they do not delay seeking treatment, whereas African-American females are more likely to die from it. This population has higher rates of hypertension, and it occurs at a younger age.
Well, that makes perfect sense.
Mm-hmm. Which pre-procedure information should be taught to the female client having an exercise stress test in the morning?
Wear open-toed shoes. I like that. Not to wear a bra. That would be a no. Do not eat anything for 4 hours. Take a beta blocker. I'm going to say do not eat anything for 4 hours.
Yes, decreases the chance of aspiration in case of emergency.
Not wearing a bra causes all kinds of artifact, and taking your beta blocker will keep your heart rate down.
That's right. And we don't want a beta blocker. We want to see what happens. Which intervention should the nurse implement with the client diagnosed with dilated cardiomyopathy?
Well, it's not supine with legs elevated. Discuss a transplant. Prepare for coronary artery bypass graft. That's not what that is. Teach the client to take calcium channel blocker. Dilated cardiomyopathy. I think they have to have a transplant.
They do, yes. Calcium channel blockers are actually contraindicated because they interfere with contractility. We don't want that with this.
It's kind of what I was thinking.
Mm-hmm. Transplant's the only treatment for dilated, so the heart's already been nice and opened. Which medical client?
Big and floppy.
Mm-hmm. Which medical client problem should the nurse include in the plan of care for a client diagnosed with cardiomyopathy?
Which medical client problem include client cardiomyopathy? Well, I'm going to say that, kind of is a heart failure issue, but I'm going to say activity intolerance.
It's not activity intolerance because we can educate to do rest.
Well, crap. Heart failure then.
There you go. Heart failure. Medical client problems indicate the nurse and physician must collaborate to care for the client, and they have to have meds for heart failure.
Ah, crap.
And medical client problem is another way of saying collaborative care.
Oh, is it now?
That's what it says.
Well, go back up there for a second then.
Mm-hmm.
Oh, okay. I was going to say I can't find it, but I see it now. All right.
Yep. Medical client problems indicate the nurse and physician must collaborate.
Okay, got you. Well,
that's good to know.
Yeah. Well, that is a...
I don't think we've seen that one before, actually. All right.
I don't think so, but that is a form of heart failure.
Mm-hmm. Client has an implantable cardioverter defibrillator, which discharge instructions should the nurse teach the client?
Cardio defibrillator. Do not lift or carry more than 23 kilograms, which is 47.8 pounds. I know it ain't have somebody else drive the car. Even though, if that thing goes off while you're driving, that could be a problem. You know? I don't really know. Don't really know about that. I'm going to say that they have to have somebody else drive the car.
It's not to.
Really?
There are restrictions, but
yeah,
they should be able to do independently.
All right, then. Microwaves don't interfere with those things anymore, I don't think. Or do they? Do they?
No, they do not.
I was going to say, I don't think they do. I think that's one of the things that they told us. So I guess you can't lift more than 23 kilograms.
It's actually the cell phone.
You're got to be kidding me.
Cell phones can interfere with the ICD as they're placed too close to it. 23 pounds. We said no more than 5 to 10 pounds. So as you were saying, it's close to 50 pounds.
Yeah, that is. I didn't know. I mean, a lot of the weight restrictions I know are 50 pounds. You know, don't lift more than 50 pounds.
Yeah. And it says, you don't want to do what? The answer is 3. You do not want to carry the cell phone on the opposite side of the. Excuse me. You want to carry the cell phone on the opposite side of the ICD.
Well, ain't that something?
All right.
D. Apical pulse.
Are you sure you want to? You sure that's your answer?
That's my answer.
Okay.
That's my final answer. Is that not right?
That is right. Yes. Aunt Pam enjoys.
Yeah. Aunt Polly takes meds. Only the A is too high, but.
Yeah. Yeah. That's that is way too high.
Yeah.
We'll leave that alone.
Yeah. But anyway.
All right. Telemetry nurse notes a peak to T wave for the client diagnosed congestive heart failure. Which lab data should the nurse assess?
I'm going to say potassium, because an elevated potassium causes peak T waves.
Hey, you got it. Hyperkalemia. Client comes to the ER saying, I'm having a heart attack. What's the most pertinent question when assessing the client?
The most important question. I guess, can you describe your chest pain?
Yes, it is. Can you describe the pain? The chest pain for an MI is described as an elephant sitting on the chest or a belt squeezing the substernal chest, radiating to the jaw or left arm. Client with coronary artery disease is described transdermal nitroglycerin, coronary vasodilator. Which behavior indicates the client understands discharge teaching concerning this medication?
Transdermal. That's a key word there, seeing how the first answer is under the tongue. Okay, the client removes the old patch before placing new one.
There you go. All right, which client would most likely be misdiagnosed for having an MI?
Is this, let's see, which one would be most likely misdiagnosed for having an MI? So they think they're having an MI, but they're not.
Yes, with atypical symptoms.
Is that not right? Okay. Peruvians, Hispanics, Native Americans, and hey, an old white dude. He's my age. Okay, so it ain't that one. An elevated troponin is an indication. Well, so you're going to say that they're having an MI and they missed it, or are they missing one but they're having one? You know what I'm saying?
Yeah, they're presenting with atypical symptoms.
All right, so they're having an MI.
Yes.
Well, it shouldn't be the troponin level because that's indicative. Well, that don't make a lot of sense right there, really.
It will when I tell you.
Well, that probably figures. Okay, CPKMB normal. Let's say 4.
It's actually 3.
3, crap.
CPKMB can wait up to 24 hours.
4 hours. Yeah, I wasn't sure what the time frame was on the CPK.
So the CPK is normal at 12. Can be normal at 12 hours. Normal ECG is your big one. Clients who are misdiagnosed are usually young females, younger than 55, and a minority group with a normal ECG. Which meal would indicate the client understands the discharge teaching concerning the recommended diet for coronary artery disease?
That's funny. Let's go with the baked fish, steamed broccoli, and garden salad.
That's always a good choice, right? That's always.
Well,
watch out for coronary artery. We need
yeah.
low fat, low cholesterol, high fiber. Unlicensed assistant comes and tells the primary nurse the client with CAD is having chest pain. Which action should your nurse take first?
I would say go to the room and assess the client's chest pain.
You got it. First step in nursing should be that. Which intervention should the nurse discuss with the client diagnosed with coronary artery disease? Select all that apply.
Well, you definitely want to tell them to stop smoking. Encourage to exercise 3 days a week. Ugh. Well, I know you want to do 1 in 3. Prepare a client for endorectomy. No, not necessarily. Eat foods high in monosaturated fats. Well, I don't know how often they need to exercise. That's a problem right there. So I'm going to say 1, 3, and 5.
It is 1, 2, and 3.
You kidding me?
You should eat polyunsaturated fats, not mono, to help decrease atherosclerosis.
Is it what now? Wait, eat foods high in what?
Polyunsaturated fat.
Okay. Well, crap. Well, yeah. You know what? I sure wasn't paying attention. Teach about coronary vasodilators. Hello. Carry your nitros around or whatever. Yeah, I don't know why I didn't think of that. I had a little TIA right there.
That's okay. At least you didn't get the carotid.
Yeah, well, I mean, just because you've got coronary artery disease, I mean, you may have plaquenol in your carotids, but you don't know necessarily until you have an echo. I mean, not an echo, but a carotid ultrasound or a CT or something that you're going to need an endorectomy. So,
gotcha. All right, let's moving on.
That's further down the line.
Yes, it is. Which lab data confirms the diagnosis of congestive heart failure?
The BNP.
Oh, yeah. Hormone released by the heart muscle in response to changes in blood volume and is used to diagnose and grade heart failure.
Yep.
You don't want a liver function test? You sure?
Well, you may want one, but it probably ain't going to help you with the heart failure problem.
Mm-hmm. What is the priority problem the client diagnosed with congestive heart failure?
What is the priority problem? The priority problem. So knowledge is not the priority. Activity is not a problem. Decreased cardiac output, that's a problem.
Yep. That's the thing that usually causes death. Priority problem. Which data would cause the nurse to question administering DIDs to a client diagnosed with congestive heart failure?
Oh man, let's see. Crap.
Oh, you know this.
Well, I know DIG and potassium is a problem. I don't remember what the normal DIG level is. 64 pulse is not, yellow. Hey, okay. I'm going to go with the potassium.
Yeah, it's always potassium when it's DIG issues. Hypokalemia can increase the risk of DIG toxicity.
I thought so.
Hypokalemia.
Correct.
The nurse is caring for clients on a cardiac floor. Which client should the nurse assess first?
Oh, I dropped my magic marker. Okay. Nurse is on cardiac floor. Which one should they success? 3 unifocal PVCs. No. Client diagnosed with CAD. Wants to ambulate. No. Mitral valve prolapse. Audible S3. I'm going to say your pericarditis patient.
It is not. That's they're normal sinus.
Well, crapola. Well, then let's go with your person who wants to ambulate.
It's actually 3.
You're kidding me.
An audible S3 is developing left-sided heart failure and needs assessment immediately. Yay, cardiac.
But, the reason why I didn't pick that is because they already have been diagnosed with mitral valve prolapse. So you already know they have an audible S3. So I didn't choose that one.
Yup. All right. The nurse is told in report the client has aortic stenosis.
That's
Which anatomical position should the nurse auscultate to assess the murmur?
Well. Let's see. It'll be on their right-hand side, second intercostal space. Did you say aortic, right? Yeah.
Yes.
Okay. 1.
Oh, yeah. Aunt Polly enjoys taking me.
That's right. They need to ask more knowledge-based questions.
Yes, they do, don't they? The nurse is caring for a client who goes into ventricular tachycardia. Which intervention should you implement first?
Well, you're not going to begin chest compressions because they may have a pulse. You ain't going to just continue to monitor them. So I got to decide whether I'm going to check for their pulse or I'm going to call a code.
You're going to check the pulse first.
Damn.
It's
That's
V-tach.
what I wanted to say, but I knew I thought if I say that,
it's going to say,
no, you should call a code. Crap.
It's V-tach. So they probably, if they still have a pulse, we have to do other stuff. But if they don't have a pulse,
I'm well aware of that, and I took all of that into consideration. But then I was thinking, they're probably going to say you got to call a code anyway.
Pulseless V-tach is treated as V-fib. Yes,
that is correct.
Stable V-tach is meds.
That would be true. I know that.
The nurse is assisting with synchronized cardioversion on a client in AFib. When the machine is activated, there is a pause. Which action should the nurse take?
When the machine is activated, well, that's because it's trying to sync. Well, I know that I'm going to say shout all clear and don't touch the bed.
Nope.
No? Crap.
That's before.
Well, I know that's what you're supposed to do first, but I guess you just wait till the machine discharges.
Yes, it's just turning on. So you have to. That's one of the whole thing of don't touch it because it's right now.
Yeah, it's trying to sync is why it pauses, but gotcha.
All right, here we go.
I'm failing.
You're not failing. You're doing 60%. You're doing awesome.
Yeah.
The client is diagnosed with pericarditis.
Okay.
Assessing the client, the nurse is unable to auscultate a friction rub. Which action should the nurse implement?
I would ask the client to lean forward and listen.
Yes. Having the client lean forward to the left and to the left uses gravity to force the heart near the chest, which allows the rub to be heard. I can't hear your issue. Let me hear it.
Well, but I mean, just because you have pericarditis doesn't mean you have a rub either, though. Necessarily.
The nurse assessing the client with pericardial effusion at 1600 notes, the apical pulse is 72, blood pressure is 138/94. At 1800, the client has neck vein distensions, apical pulse is 70, blood pressure is 106/94. Which action should you do first?
Well, I'm going to say notify the healthcare provider.
You would do that second.
Ah, crap. That's funny. All right.
Remember, we talked about this yesterday. What's the first thing you always do with the patient?
Stay with the client and use a calm voice.
Yes.
Jeez.
You need to call the nurse's station for that one. It's a medical emergency. You should stay with the client. Never leave the client in a medical emergency.
Gotcha.
So if the option is to stay with them, stay with them.
Yeah, well.
The client submits to the ER, and the nurse suspects a cardiac problem. Which assessment intervention should the nurse implement? Select all that apply.
Client in the ER. Cardiac problem. All right. You got a cardiac problem. You need to put them on telemetry. You need to start an IV. You need to request an order for a 12-lead EKG. Basic metabolic program. Panel, though. I don't know if you might want to, if you need basic or if you need, I'm going to say 2, 3, 4, and 5.
Just 2, 3, and 5.
Crap. And you need a CMP.
Yeah. And what? Yeah, exactly.
That's what I was debating against picking that one.
BMP will not specifically tell you about cardiac problems.
Yeah.
And the question is asking you about a cardiac problem.
Correct.
You can have potassium and sodium in there, but we're looking for specific cardiac issues.
I agree. But I don't know why. I'm afraid all the time about, if I don't pick that, that's going to be part of the answer. But if I do pick it,
it won't be part of the answer.
I know. I hate us. Jeez.
That's all right. That's what we're doing these for.
Yeah.
Find these little things.
All right.
All right. Client's 3 hours post-MI. Which data would warrant immediate intervention by the nurse?
Let's go with cool, clammy, diaphoretic skin.
That's always a bad thing. Indicator of cardiogenic shock. The nurse is transcribing the doctor's orders for a client with CHF. The order reads 2.5 milligrams of Lanoxin daily. Which action should you implement?
Lanoxin. North Lanoxin.
This is a drug question.
Yeah, I know. Lanoxin. Dadgummit. Oh, let's see.
If you don't know this one, don't feel bad because this requires you to know the med.
Yeah, I am trying to figure out. Let's see.
Give it a guess.
I'm gonna say to Check the potassium level before you give it.
The actual answer is 1.
Ah, man.
It's 10 times the normal dose.
Oh, okay.
That's what I'm saying. Like, if you didn't know it, don't feel bad.
Yeah. Well, I don't know. I was just trying to figure out. I was trying to think that it might be in the same class as digoxin.
It might be, but like I was seeing, like, and this is kind of how, if I don't know it, I have to kind of go through and guess it. And I'm like, okay, 2 apical pulse, it's a cardiac med. Then check potassium. I'm thinking dig. Determine dig. I'm thinking dig. I got to throw 3 and 4 out. And then I take the apical pulse versus healthcare provider. I would guess healthcare provider. But that's just how I have to go through these questions when I don't know it. Especially because all it said was a drug and a dose. So, all right. The nurse is teaching basic CPR to individuals in the community. Which is the order of basic CPR? List an order of performance.
No, crap. I never get this right either.
We usually get the first part right.
Yeah, shake and shout.
Yeah, that's the first part.
So you shake and shout. And I am by myself, I'm guessing, or they are by themselves. It doesn't say, does it say 2 people? Which is the order?
It just says 1 by your seat.
All right. So you shake and shout. You begin compressions. Then you do the head tilt chin lift. Then you look, listen, feel. Then you give 2 breaths.
Yay! That's right.
I'm surprised I got that right.
Well, let me say, yeah.
I'm so accustomed to doing it the old way.
That's right. If you did it the old way, you'd be wrong.
Yeah, I know. That's why I miss it, because for years and years we were taught the first thing you do is shake and shout, but then you open or you do the head lift, chin lift, head tilt, chin lift. Then you look, listen, feel. Then you give 2 breaths. Then you start compressions if they need them.
That's the old way.
I know. That's what I'm saying. But that's how I knew to do it for years and years. I don't like change, Dave.
I don't like it. All right. We're going quick. It's nice. During a routine physical exam, a client... Let me zoom in because we're getting small now.
That's big enough.
During a routine physical exam, a client reports recent occipital headaches, blurred vision, fatigue, and increased edema. The nurse reports these findings as indicative of...
Let's go with hypertension.
It's hypertension. Client's parents ask the nurse, what is the prognosis of myocarditis? The most appropriate response by the nurse is...
Oh. Let's say recovery usually happens without special treatment.
You got it. Yep.
And I only picked that because the other 3 don't make sense.
Mm-hmm. That's all you can do is, if you don't know.
I really didn't know that no treatment was the right.
Let's see. A heart transplant is late stage, which rarely occurs. Coronary is for people with vessel disease. Angioplasty is indicative for people with coronary artery lesions. Myocarditis is usually asymptomatic.
Yeah. Dude, this coffee has about killed me. I've got to take about a 3-minute break here.
All right, do it.
Can we do that? All right, I'll be right back.
Go for it. Well, that sounds good. Doobie doobie doo 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 doo. If you're watching at home, feel free to take a quick minute and fast forward to where we start again, because we can't really stop this stream. We can't stop the streaming. We can't stop the streaming. Doobie doo doo doo. Doobie doo boo boo boo. Boo 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 doo. Do 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 do. If I only had a brain. Oh my, the fan's on me. Gotta put some music on. Gotta put some music on.
Man, I fully expected you to have on the,
I was totally singing to everybody who's watching at home.
All right.
That was like a minute. Sweet.
Well, my prostate's not, completely messed me up yet, as Dr. Who said, or whoever, whatever. I don't know if she's a doctor or not, but anyway. Let's move on.
Moving on.
Oh, crap. I hate these.
The nurse is planning the care of a client in the acute stage of bacterial endocarditis. Which of the following interventions should the nurse include?
Well, let's say rest, analgesics, and antibiotics.
You win.
Yes. I got to select all that apply right.
Yay. You just need to get a few more.
It took 29 of them to get one right. That's
okay, though. You're on a roll now.
I'm on a roll now. I'm on a roll of one.
Hey, it takes one to start.
Yeah.
Client who has hypertension asks the nurse why a urine sample is needed. The nurse informs the client it is to check for
one.
Yes, protein. Kidneys can be affected.
Yes, they can. We learned that in nursing school.
We did? I don't remember anymore.
That's a good one. That's a knowledge-based question. I like that.
What's the following order should the nurse question the client who has been admitted with a possible MI and active PUD?
PUD. Liking me some PUD. Well, let's go with aspirin.
You win.
They taste bad anyway.
Antiplatelet effect, possibly promoting more GI bleeds. Oop. All right. The nurse's client asks, how did I get rheumatic heart disease? The most appropriate response is that the disease is frequently a result of
streptococcal infections.
Boom. Beta hemolytic strep.
More knowledge base.
Don't we love that?
Yeah, keep them coming.
Hey, select all apply.
Except for that means that you're not getting your questions right.
Which of the following interventions are a priority during exacerbation of left-sided heart failure?
Left-sided heart failure.
What do we say about left-sided heart failure?
Well, I don't know. What did we say about left-sided heart failure? Are you talking about, the lungs? You mean left lungs?
Okay.
Is that what you mean?
I was making sure we had other. That's what it was about. I was thinking about it today.
Well, all right. A priority. Well, what is it? An exacerbation. Hey, there you go. Of left failure. All right. 1, 2, 3. Left side failure. Priority. 1, 2, 3. I don't know about 5 and 6. Let's say 1, 2, 3, 5, and 6.
The answers are 2, 3, and 6.
Ah, crap.
Albuterol is somebody who has asthma. This is just a sided heart failure.
Well, I understand, but
diuretics will get rid of the fluid. Of course, oxygen treatment.
We give crap and breathing treatments to people with heart failure all the time because they can't breathe.
Well, we knew it wasn't IV fluids, right?
Well, I didn't expect it to be IV fluids, and
it's not.
Know if, yeah. I'm basing too many of my answers on what we've done for years, as opposed to what was that place you called? Utopia General Hospital.
I was gonna, I have to think of the White Ivory Tower Nursing.
Yeah.
Welcome to Sacred Heart.
That's true.
All right.
Because we tell people all the time, I couldn't tell you how many times we've given breathing treatments to people who are in pulmonary edema as a result of left-sided heart failure. And, they'll call for a breathing treatment. And you go up there and say, we're giving breathing treatment, but it ain't going to help. So, why in the world I don't answer what I know as opposed to what we do
Mm-hmm.
I guess because I've got brain damage.
It's okay. You don't have brain damage. You have nursing school. You're like, put that, put this, put that.
Yep.
All right, here we go. The nurse is preparing a client to be discharged after a diagnosis of heart failure. New. Which of the following statements by the client shows appropriate understanding of the nurse's teaching?
Okay, it is. I will call my doctor if I gain more than 2 pounds in a day.
Yes, we don't want to gain.
Because all the rest of them are wrong.
Mm-hmm. All right. Finger sticks for sodium. Oh,
I like the finger stick for sodium.
Oh, man. All these select other applies are coming today.
They're good.
The nurse should monitor a client after a coronary angioplasty for which the following manifestations indicating cardiac tamponade.
Oh.
For signs of cardiac.
Oh. All right. Muffled heart sounds is one. Hypotension should be one. Okay, so let's say 1, 2, 5, and 6.
You want to say those numbers one more time?
1, 2. No, it's not 2. I didn't mean to say 2.
I know you didn't mean to say 2.
1, 3, 5, and 6.
There you go. Clinical manifestation.
It's not a headache. It's hypotension.
It's hypotension. Yeah, I was like, you said hypotension. Why are you saying headache?
Well, because I have, attention.
Brain damage.
Yeah, I've got brain damage from nursing school.
The nurse is caring for a client who has an allergy to penicillin. Immediately after receiving cefazolin, IV for prophylaxis for a pacemaker insertion, they become restless, tachycardic, and hypotensive. Which the following interventions should the nurse implement as the priority?
Well, she's all right. Restless and tachycardic, hypotensive. Well, you ain't gonna do a stat blood culture because there's no such thing. Restless tachycardia, hypotensive. We don't have a red petechial rash, so we don't need a thrombolytic. All right, so we're having a reaction. That much I know. And you give epi for that. So let's give epi.
You win! Exactly.
Well, I couldn't decide whether I wanted to, but then they see they're tachycardic, and so I don't want to give them epi, and I don't want to give them atropine, but epi is for the reaction.
Mm-hmm.
All right.
Severe allergic reaction.
Yeah, because atropine's for symptomatic bradycardia.
There you go. All right. After an MI, a client has concerns about when it is safe to resume sexual activity. The most appropriate response by the nurse is to...
It is never safe. Okay. Oh, it's number 4. I remember that.
2 flights of stairs.
From whenever way back.
First year final.
As a matter of fact, I think that's from our fluid and electrolyte and cardiac teacher. Told us that.
I think so. I think so. All right. And preparing a client for transesophageal echocardiogram, excuse me.
Yeah.
The nurse should include which of the following in the client education. So we're looking at transesophageal echocardiogram.
Correct. All right, so it ain't 4, it ain't 3. You'll need a designated driver to take you home, I'm guessing.
That's right.
Because they're going to sedate them for that.
Mm-hmm. After receiving a permanent pacemaker, the client asks the nurse if there are any activities to avoid during a vacation scheduled for 4 months after discharge. Which the following is the most appropriate response by the nurse?
Huh. Well, no restrictions on your activity. I know the running engine thing is wrong. And the microwave thing is wrong.
It is the running engine.
For real?
Mm-hmm. Electrical impulses could change something that early.
God. Oh, jeez. Okay. Man, I'd have never picked that.
I didn't think. I was like, what? Yep. We know it's not the microwave.
I was thinking it should be healed, so swimming shouldn't be a problem.
Nope, it should be healed. Mm-hmm.
Jeez Louise, a running engine. Okay. Well, that's interesting.
Yep. Hey, that's good to know, right?
Well, I guess it is, in case I ever get a pacemaker.
Mm-hmm.
I have to hire a mechanic from then on.
After a client with coronary artery, choose your son. After a client with coronary artery disease develops heavy substernal chest pain, which the following intervention should the nurse do first?
Well, it ain't albuterol. It ain't 4. And number 2 is what I would want to pick, except for the fact that it's contradictory to what we were just told in our review class. Call 911 after the first one.
Well, just don't worry about that as much.
Well, then I'll say 2, because that's
yes.
Okay.
Yeah.
Well, she said you call 911. You sit down or lay down, take your nitro, call 911.
Mm-hmm. That's what, and I remember thinking about that when we first took cardiac, and they said it was weight 3, and I was like, all right. So, well,
I remember what she told us the other day. See, so I missed that question based on that response, but all right.
Oh, a diet question. Then we're gonna jump because we have about 20 minutes left, and I want to hit some other stuff.
I hate diets.
All right. The nurse assists the client with coronary artery disease to select which of the following menu choices.
Select all that apply. Which ones can people with CAD eat? Let's say,
It's a good one. It's a good question.
I bet it is. I don't like it already.
Just think about it. Coronary artery. We have to think about the heart.
Yeah. Yep. Well, all right. So 2% milk, tomato juice, and mozzarella cheese.
Okay. Let me go through this with you. Cardiac. Are we doing salt?
Oh, so I guess there's salt in the tomato juice.
Oh yeah, it's tomatoes. It's tomato juice. There's a high salt content.
Not if you drink fresh squeezed tomato juice.
Nobody drinks fresh squeezed tomato juice. Yeah. And is there something better than 2% milk?
Is there something better than 2% milk? Yeah, I would guess water.
Skim milk.
Oh, skim milk. Yeah.
Which is pretty much white water. So the actual answers are tortillas and mozzarella cheese.
No kidding. Lord have mercy.
Mm-hmm. But you got the mozzarella cheese, right?
Oh, hey. 1 out of 6. That's fabulous. That's what, 20%? I mean, I need.
Well, you actually technically only got 1 out of. You got 50%. 1 out of 2.
Yeah.
But just remember, there's something better than 2%. Tomato juice is high salt and it's cardiac.
Yeah, I didn't think about that better than 2% thing.
Yeah, neither did I.
And I didn't think about the salt in the tomato juice because I don't drink tomato juice anyway, so I don't know if it's salty or not.
All right, I'm going to jump down. We got about 15 minutes, so I'm going to jump down. We got 100 of these things, but there's a couple ones I want to get to specifically.
Oh, okay.
All right. All right, let's start with let me jump on down. Jump on down.
Jump down, turn around, pick a bale of cotton. Gonna jump down, turn around, pick a bale of hay.
I like that.
You don't know that song, I'm sure.
Well, it sounded pretty then. All right, the client. Let me move this over a little bit.
It's a song we sang in grade school, actually.
The client being prepared for cardiac cath. Which statement by the client warrants immediate intervention by the nurse?
Being prepared for cardiac cath. Took my blood pressure medicine yesterday. Got an awful rash after eating oysters. That one.
You got it. Allergic reaction to iodine. All right, we're gonna skip over that one. All right, look at this one for me.
Is an oyster a shellfish?
It's in a shell.
Are shrimp shellfish?
Shrimp are shellfish. All right, let's look at this, Jeff.
Oh man, I hate these things.
That's why I wanted to do them. Look at that. The first question is the heart rate is what per minute?
Let's see. Let's start right here. 7, 8, 9, 10, 11. Well, I wish you'd quit moving that.
Sorry.
Because I'm trying to count the blocks. 15.
I think these are all 6-second strips.
1. Oh, are they? Well then, 79 is the heart rate.
Look at you getting stuff right already.
If that's a 6-second strip.
This is a 6-second strip. Yeah.
Hang on, let me go back to what I was doing. 1, 2, 3, 4, 5. Well, that's good that it's a 6-second strip then, because when I counted it for a 3-second strip, I get the wrong answer.
Don't be doing it for 3-second strips. I always do. See, there we go. All right, next one. Yay, another one.
Another one.
All right.
The following can cause this heart rhythm.
Select all that apply. I'll move down one more. There you go.
6, 7, 8, 9, 10, 11, 12. Ooh, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So it's just sinus tach. Let's see how long this is. 1, 2, 3, 4. So the PA interval is not too long. QRS is less than 3 blocks or 3 blocks. It's got a peak T looking. There's no pacer spikes. It's not a vagal response. Tachycardia, basically. So stress.
Select all that apply.
Oh. Okay, then. Stress, smoking, and pain.
You win.
I didn't know it was a select all that apply.
Yep, SATA. Sorry.
Okay. Oh, that's what. Okay.
Sorry, I had to type this one up for us.
Okay, I didn't.
Look at this one. This one's
that's a dandy.
What's this rhythm?
It's you got a sinus. QRS is normal. T wave. You got a little ST depression. But that's some serious sinus bradycardia.
Look at you.
Heart rate of 30 is pretty slow.
Pretty low. Next. Ooh.
All right.
There you go.
8, 9, 10, 11, 12, 30, 40, 50, 60, 60, 18 is the rate. Times 10 is 180. And it is, I don't have calipers, but let's use something to measure with here. All right, it's regular enough, and I see P waves that it's not atrial fib. There's no pacemaker spikes. Let's say exercise and exertion.
I thought that too, but it's not that one.
Really?
Mm-hmm.
Rapid firing from multiple sites in the atria.
That's it.
Is it?
Mm-hmm. I did not know. Oh, excuse me. Not the atria. I apologize. I thought you were reading the bottom one.
No, it's not the bottom one.
That's what it's. Yeah, this was from the book.
It says it's the bottom one?
It says it's the bottom one. It says the pacer spike is hidden.
Oh, I was going to say there's no pacer spikes.
Yeah, it says the pacer spike is hidden.
Oh, okay.
I was like, all right, I'm putting this one in here.
Well, no, that's ridiculous, though. I mean,
I didn't like this one.
Yeah, you can't know that if you don't see the pacer spike. I ruled that one out first thing. There's no pacer spike.
That's what I thought too, and that's why I threw it away. But I said the same thing.
Well, thanks for putting it back in.
So just I rule, just so you know.
All right.
I doubt that'll happen, but again, I was like, oh, I'm gonna delete that one later. Those of you online, that was a fun one.
That's a little BS there, Dave.
All right, let's do this one. This is
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. So the heart rate's 130. So it's not V-fib, it's not atrial fib, it has to be sinus tach.
You got it. I thought that was a weird one.
Well, it's just baseline wander. So other than that, and somebody's got the amplitude turned up really high.
All right, here we go. 88. Woo!
Well, 1, 2, 3, 4, 5, 6, 7, 8. Well, let's see. Crap. I don't have anything to measure with, Dave.
You don't have to measure.
I do have to measure. Let's see. That is here. Let's see. It's right there. Right there. Right there. Right there. All right. So it's not irregular. I'm going to say it's sinus rhythm with artifact.
You got it. All right.
Oh. All right. Let's see. That is 1, 2, 3, 4, 5, 6, 7, 8, 9. So it's a heart rate of 90. There is a sinus arrhythmia. Shouldn't be the beta blocker constant. Well, I don't know. Could. 1, 2, 3, 4, 5, 6, 7, 8, 9. Kemosabe.
Kemosabe.
Yeah, that's which medication would you expect this patient? Oh, what would be ordered? I was thinking what would cause it. I was going to say, Well, the only cardiac drug up there is Timolol.
It's not the one you'd expect to be ordered.
Oh, okay. So
Timolol is usually the one you do ophthalmically.
Right. Okay, then I'm guessing that they're considering this to be an atrial dysrhythmia, so Coumadin.
Coumadin. You don't want Lampadine?
Even though it looks like I see P waves, but
yeah. If you don't want Lampadine? Whoa! That's itty bitty. Hold on. Let me shrink. Let me get this back up to size.
It's all right to be itty
bitty. All right. That's math. We can do math later. All right. Here we go. Last 10. Clients prescribed diltiazem to manage his hypertension, cardizem. The nurse should tell the client with diltiazem, but diltiazem will do what?
I'm going to say 2.
It is 2. I saw this happen the other day. It was interesting. Up on the special floor that I was on.
You were not on a special floor.
With my special eyes.
A lot of people mispronounce that drug. They call it cardism.
Cardism? It's cardism, isn't it?
I know, but a lot of people, and when you are around a little while, you'll hear people call it cardism.
Like, that's not cardism.
I know there's no A in it, but people call it that anyway.
Client reports substernal chest pain. Test results show echocardiographic changes in elevated cardiac troponin levels. Which should be the focus of nursing care.
1.
Yep. Oxygenation.
Improve oxygenation and decrease cardiac workload.
Calm down the heart. Client with MI and cardiogenic shock is placed on an intra-aortic balloon pump.
Oh, I love those.
If the device is functioning properly, the balloon inflates when the...
All right. It inflates on the dicrotic notch. I know that. So it should inflate right after the aortic valve closes.
There you go.
That place on your pressure wave is called the dicrotic notch, by the way.
I didn't know that.
And if it's not there, you can really injure, if not kill someone.
Well, that's good to know. I'll make sure that it's there.
Well, you won't typically see those or work with those unless you're in a cardiac intensive care unit. Usually that's where.
Oh, gotcha.
Yeah, I don't. Well, I've seen them out in the regular ICU, but I think it's pretty uncommon for them to be out there. They're usually on post-op heart people who are, having failure issues.
A client with unstable angina receives routine applications of nitro. The nurse should delay the next dose if the client has.
Client receives unstable angina. A client with unstable angina. Routine application of nitro. Let's say, let's see. Boom. I don't know about the atrial fib thing. Let's say 2. Systolic blood pressure below 90. Okay.
It is, yeah. Atrial fibrillation is not a contraindication.
Okay, I wasn't sure if it was or not, and I really didn't know how low your blood pressure had to be. I just know that
the hypotensive.
It's going to lower your blood pressure. So
let's not give it. It's already low. All right. Client experiences acute MI. The nurse administers oxygen, sublingual nitro. When assessing an ECG for evidence the blood flow to the MI has improved, myocardium has improved, the nurse should focus on the
it should be return of the ST segment to baseline.
It is, yes. During episodes of MI, an ECG may show ST segment elevation or depression. With treatment, the ST should return to baseline. Following a left anterior myocardial infarction, a client undergoes insertion of a pulmonary artery catheter. Which finding most strongly suggests left-sided heart failure?
A rise in pulmonary artery diastolic pressure.
Look at that lung thing. Here we go.
Well, the deal there is in order for we used to actually monitor those when I first got out of school years ago. The deal there is if your left heart is not working, the fluid backs up into the pulmonary vasculature. And so therefore you'll have a rise in pulmonary vasculature pressure.
Yep. And that's what number 4 should be, a rise in mean arterial pressure.
Yeah. Well, that's just a little, it's been a long time since I've had to look at that, but.
A client with dilated cardiomyopathy, pulmonary edema, and severe dyspnea is placed on dobutamine, which assessment finding indicates the drug is effective.
Let's say the blood pressure of 160/90, even though I don't like that.
No. That's not their
okay. Increased activity tolerance.
There you go. Should improve the symptoms.
Yeah, because that's too high. So.
All right. A nurse administers warfarin to a client with DVTs. Which lab value indicates the client has therapeutic level of warfarin?
Oh. Well, hematocrit ain't got nothing to do with it.
Just remember, Worf's in Korea.
Yeah. INR of 3 to 4 is too high, isn't it? 2 to whatever.
2 to 3.
All right, prothrombin time partial. PT. Okay, so it's PT.
Yes, Worf's in Korea doing physical therapy.
Yeah.
Eating his leafy greens.
Yeah.
A client comes to the ER with a dissecting aortic aneurysm.
Oh, that's bad.
Client is the greatest risk for what?
Let's say cardiogenic shock. No? Well, damn.
Dissecting.
Well, let's just say then that it ruptured and they have hypovolemic shock.
That's the greatest risk for a hypovolemic shock due to rupture.
Yeah, well, that's...
All right, Jeff, this one...
say it had ruptured, though. That's why I didn't choose that.
Well, it says greatest risk for.
Yeah. Greatest risk for
hypovolemic shock because it's dissecting.
Right.
All right.
If it's not bleeding, then it's not hypovolemic. See, so that's you don't have hypovolemic shock unless you have low volume. You don't have low volume unless you are actively bleeding.
Which is why it says that their greatest risk for because it's dissecting.
Yeah.
Yeah.
I guess so.
All right. This is a big one.
Crap. Oh, man.
I put this one in here because I found it. I was like, oh, yes.
That's a whole lot of reading.
Nurse is caring for a client who had a resection of an abdominal aortic aneurysm yesterday. The client has an IV infusion rate of 150 an hour, unchanged for the last 10 hours. Client's output for the last 3 hours has been 90, 50, and 28. 28 is your most recent. Blood urea nitrogen is 35, and the creatinine is 1.8. Which action is priority?
All right, so they're starting to have renal failure. I would suggest you need to call the healthcare provider.
You got it.
Because none of those other things are going to fix it.
Nope. All right, so that was an hour of questions. We got a good chunk of them done.
Well, I'm sorry, I'm a little slow.
No, you're fine. We got through a good chunk of them. That's about what I thought we were going to get to. I wanted to make sure we saw this last little bit. So I'm going to stop the broadcast.